One of the things that I think really distinguishes the Johns Hopkins Children's Center from many other places is that from the very beginning, it was a place where the faculty here were committed not only to giving state-of-the-art of care, but actually changing care.
There it goes right in. You know, when you go to the hospital, you can guess you're going to find doctors and nurses and other support staff. That's pretty much the norm. But when a patient comes to the Johns Hopkins Children's Center, there are some other health professionals who are critically important to the healing process. The child life specialist.
An elephant could not live here.
So is she watching or is she looking away?
The role of the child life specialist is to help to ensure that children and families are comfortable while they're here in the hospital, really helping to reduce a lot of the stress and anxiety associated with hospitalization. So a child life specialist might be found providing preparation for a procedure, helping to normalize the hospital experience by providing play opportunities for kids. Playtime is so important for kids when they're here in the hospital because it's the one thing that can be seen as a normal thing.
Well, the hospital can be somewhat of a frightening experience for adults and especially for children. And we know now that children really want information about their illness.
Doing a great job, Ducky.
One technique that child life specialists use is something called medical play, where kids are given the opportunity to sometimes to use a blank cloth doll, and using this they're able to become more familiar with the medical equipment, whether they're starting an IV on the doll or using a stethoscope to listen to the doll, just like the nurses and doctors have done to them.
Using those dolls and real medical equipment, we can learn from the child what's their biggest worry. What's really going to bug them that day? And if it's important to the child, it's important to the healthcare team. Child life specialists are an integral part of the medical team, and it is now the standard of care in pediatrics to have emotional support be part of the team discussion.
Our team together really does help to make the whole package for families here in the hospital.
Hey everybody, and welcome back. This is our third round of hospital bingo today.
Every child who comes here, they know Wednesday afternoon, it's bingo day, doctors don't talk to them, don't schedule procedures, it's bingo time. It's extraordinary. I mean, it's such a valuable resource.
Hospital bingo is our centerpiece show. It's what I would call perfect. So what we do is, as I describe the piece and they look for it on their board, we talk a little bit about the function and the use of each piece of equipment. And surgical gown. This is worn by hospital staff. So there are a variety of ways that kids can be involved in bingo. We actually play the live feed in a playroom, so kids are there watching as I'm hosting. So that's one experience. There's also a great thing that they can play from their bedside. You just flip onto channel 60. You have a phone by your bedside, and you can just call in and play that way just by calling the number in the teen room. And there's somebody else on the phone. Hi, this is Bingo.
Hi, this is Michelle.
Bingo is also very popular because we have wonderful donors in the community who donate money or give prizes that we actually give out. Every child that plays gets a prize. So we have an average of about 75 kids that play per week, and sometimes they can win multiple times. We play 3 rounds, so it's a lot of prizes. I can't imagine what the hospital experience would be without child life.
She sits in her room, she's unhappy, you know, there's nothing to do, she feels sick, she feels terrible, and you have things to look forward to with child life. It gives you some structure to your day when you're in this place, and it's sort of endless days of unhappiness in a way, and child life brings you happiness.
There it is. Great
It is my
job.
vision that there will be a time when wherever a child interfaces with Johns Hopkins Medicine, there is a child life specialist there to help them prepare for the difficult experiences they might have. We're not quite there yet, and we really need partners in the community to help us get there.
It's essential to making a child well. You can't just give them medicine and injections and needles. You have to give them love to help them heal. Child life does that.
There are 22 people in the Child Life Department here at the Johns Hopkins Children's Center. Child life specialists often come with a degree in child development or child psychology, and many colleges now across the country are offering a program of study specifically in child life. Call us at 410-823-1065 or log on to hopkinschildrens.org to make sure Child Life can keep making life fun for young patients.
One of the wonderful things, if a child has a birthday in the hospital, they have a very big birthday party, including gifts, okay? Because we know how special that can be to a child. All of these things are carried out by Child Life because they understand how very, very important these things are for both the child and their parents.
Hi, I'm Rebecca, and I'm a Child Life Specialist here at Johns Hopkins Children's Center. I'd like to thank Food Lion for being such a good neighbor and donating lots of money to Hopkins Children's. Because of you, the Child Life staff is able to fund special projects and purchase toys and games that make staying here in the hospital more like home. Thank you, Food Lion, for making miracles happen every day here at Hopkins Children's.
Thanks for watching our ABC2 special, Johns Hopkins Children's Center. Today's discoveries, tomorrow's cures. If you would like to help, call 410-823-1065 or visit hopkinschildrens.org.